So the first thing that came to my mind is thinking about listening to all of the speakers today and taking this all in is really humility. And thinking about entering into this, of thinking of creating a movement. And I don't know how many of you are aware of the book called Theory U. It's by Odo Sharma, and it's about leading as the future emerges. And in it, he talks about that we often, with complex problems, we want to get to a solution, and we want to go right over here, you know, problem to solution. And that's some of our eagerness to, you know, get things done. And yet he says there's really a theory U by which you solve complex problems. And that first you go down this U and you focus. So that's that whole thing about clarifying what we're trying to accomplish, our goals, our values, you know, what would this look like to have a movement that achieves population health and health equity. But then you broaden. So this whole thing about being more inclusive, what Tony talked about, we've been exclusive. How do we broaden? How do we bring more people in? And then you deepen, and you come to a shared perception. And then when at the bottom of the U, you actually get to a common purpose. So that's kind of interesting what Jeff said about bringing us together more, a common purpose. And then as you go up the other side of the U towards your solution, you get to new thinking and new principles. So do we need new thinking and new principles? That brings me back to the humility part, or the humbleness of what I don't know about what we need to accomplish here. And then you get to new processes and new structures before you get to those solutions. And so that whole thing about what Marshall talked about, leadership and needing new structures and not being structureless and thinking around that way. So that was the first thing that came to my mind as I listened to today, is that we need this theory U thinking, and actually he calls it open mind, open heart, open will. And I think this whole thing of what leadership are we being called to, and what does that leadership look like? And that whole part about healing that was talked about today. So that was the first thing, is our role in this, traveling down this U and getting to the place that we need to be. Our role as Population Health Roundtable, Duran, we've both known of each other, but we haven't actually sat down in Minneapolis, and so that's one of the things we're going to do subsequently. We've admired each other from afar. But she was saying, if you remember, that she had some legitimization in her father's eyes because she was coming to IOM and she was coming to speak. And then she talked about the 100 and thousands and probably 10,000 community organizers who are out there already doing this work. What could we do as IOM that brings some legitimization or brings some extra oomph to what they do? Maybe it's doing some research for something that needs to be done, or maybe just putting the name with it, or what would be helpful or not helpful? I don't know. That's where that humility part comes in. But figuring out what our role would be. I think the thing about thinking around our driver diagrams, so George, you're going to love it that I'm bringing up the driver diagram again, about exactly what are we trying to accomplish, what would it look like in the end, what are those goals, what are those values that we should be articulating, and being clear about that. Clear about what are we fighting for, or what are we fighting against. And I don't, it's probably a mixture of that pieces. I appreciated what one speaker had to say about the opportunity, the political window. And I think there is a political window right now around healthcare cost and the fact that we're not getting good value, we're not getting good health for all that money we're spending. I think that's a great place for us to think about how do we be more proactive about getting our voice out there now in editorials and places to say there is a different way. We don't just have to bemoan rising healthcare costs. There is a better way in trying to get us to the health that we all need. I think this concepts of the movements, of being grassroots, but also this treetop piece, I thought was very intriguing, and thinking around what's that combination, and what would be our role in that. Maybe we're not grassroots, but maybe the treetop part we ought to be thinking about in some way in that piece. I thought it was also interesting when they said, when you're successful, you will be focusing less on this Marshall Gant saying, what's my issue and who are my people? Who are the networks? Is that relationship piece. So how should we be leveraging the relationships that the IOM has? And what would that look like? And are we really capitalizing on that besides just listservs? Are we really building relationships in the way that we should be thinking about that? And the part about the formal training and the informal training and the grassroots leadership training that Duran talked about, what would be something that we could do in that or even learn in that? Or is that something where it's like I'm a physician by training. It would be like physician practicing without a license. We shouldn't go there. That's not our place. But just that training part really, that there's a real science and mechanisms and strategies behind all of this. The other part that I don't know that we feel so comfortable with is this whole thing about challenging of the power. And yet if we're really going to get the change that we believe we need, we're going to have to challenge power. And is that our role? Is that our place? And yet I think about healthcare being 1/6 of our economy. If we don't challenge that investment that we have that continues to go up and up and up, if we don't challenge that, we're never going to get to the population health. I loved it when Mary Pittman, in the article that was in our packet to read, said, as long as incentives and reimbursements in the healthcare system remain primarily tied to treating diseases rather than promoting health outcomes, we will never effectively address or properly encourage and reward what contributes to good health in the first place. What's our role in challenging that power? And what would that look like? And one of the things that I really worry about for the future is that we have, as our baby boomers move through, we could end up spending our total heritage on this population as it moves through if we don't change the kind of care that we're providing to people that they don't really want, and the waste that's in the healthcare system now that we've sold to them as good. Meanwhile, that population, we will have spent everything on that. And this emerging population, the changing demographics that we have, we're going to spend this all over here, and we're going to rob education resources, housing resources, all of those things that add more to a person's health than health care. What's our role in shining a light on that? That's really coming up against 1/6 of our economy. Do we want to take that on? Do we not? Something for us to discuss, and what would that look like? The other thing I found very interesting is the whole thing around language, and it came up multiple times about words we use and how they can, bring people together, or they can really marginalize us. And so in just thinking about the words that we use, I love if moral imperative doesn't work, go to economic, imperative. Thinking around, equity versus equal opportunity, racism versus racial justice. Words matter. And so thinking about as we move forward, even putting out, I found it so helpful what RWJF put out previously about how to talk about social determinants of health. Should we be putting out something that's supplementary to that, or magnifying that work more about, how do we use words that bring people together to work on this? The comments particularly around like personal responsibility, community responsibility. It's not one or the other, it's both, and how do we make certain that people are hearing those parts. And then I think the last thing that really inspired me, I'm humbled, but I was also inspired by the words of this whole concept that Marshall Gans had about there's pain, but there's hope. And how do you find the right Venn diagram? And how do we as a roundtable continue to illustrate that or bring that out? Kind of the challenges we've got in front of us, but the hope. And that talked about the almost the mantle of leadership, taking the leadership that can be yours and the call to healing. And I wondered if that was something that would resonate for us in population health as well as resonate for health equity, that there's healing that needs to be done in our land, and what's our job in shining a light and magnifying that as the roundtable.